Are you the type of person who sets New Year's resolutions? So when it comes to income, do you set yearly income goals? Just like your yearly New Year's resolutions, do you achieve your income goals? Well, I have income goals as well. I have this job and I'm not on fixed income. But in this job, possibilities are endless. I call a sales job a job with jackpot. Not like casino jackpot, but hard work jackpot. This is my story when I decided to become Medicare Advantage sales agent. As ambitious as I am, when I learned that Medicare is nationwide, I told myself, wow, no ifs and buts. I felt like I can conquer the whole United States. Then I told myself, if I know Medicare, I can answer a Medicare question asked to me from one end of the United States to another. So now, what if I tell you my boss is here to talk about how you can make six-figure income? Will you be interested? This is a chance for you to make your financial goal a reality. So join his successful team since he can guarantee your success. He's approachable, and we all work as a family with a typical corporate setting, of course. Well, you can approach him for any project, and he will be there to guide and support you. Well, for my healthy senior segment, how about the chicken dinner ideas? I got some for you to, well, if you want to take a look and see what this video has to offer, why not, right? So then for my Medicare segment, well, it's not yet too late to talk about what is new and important with Medicare in 2023. Likewise, I will also show you ways on how to enroll with Medicare. Well, these topics will surely help you with your Medicare journey. So, no matter what state are you from or what work you've done, you must transition to Medicare at a certain point in your life. MariaCares Senior Info Guide has a mission to bring Medicare information right to your home. I'm your host, Maria Garcia, a licensed sales agent, always available to assist you with your Medicare concerns. Well, of course, we're broadcasting here in the marvelous city of Las Vegas, the city full of entertainment. Come on, let's join hands to a better health.
With the many recent changes and focus on immigration law, now more than ever is the time to seek the help you need from an attorney you can trust. As an immigrant myself, I know the many difficulties and hardships involved in immigrating to this great country. With more than 10 years of experience in handling immigration cases, our firm can provide the necessary answers and solutions to your needs. Call Calderon Law today so we can work together to help you get the peace of mind you and your loved ones deserve.
We use headphones as a part of our everyday lives. Whether we're at work, getting exercise, meditating, in transit, studying, practicing, or relaxing.
Hi, I'm Ryan Sway, the founder of Aircom. I would like to introduce the world's first wireless airflow audio earbuds. As a festival and a concert junkie, I really enjoy the live experience of being there and feeling the music. When we started developing Airflow, our goal was to reproduce that live experience using earbuds.
The problem with traditional headphones is that the speakers are located inside of the earpiece, literally giving you centimeters before the audio hits your eardrum.
What Aircom is doing, they're the first company to actually address the fact that there needs to be a space involved associated with having the sound waves expand fully.
The difference between traditional headphones and Aircom audio is that the air tube gives you 8 times more space, allowing the sound waves to fully develop before they actually hit your eardrums. And this gives it a much more live, natural sound, just like in a recording studio.
It's real nice that someone actually addressed the physics associated with how sound comes out.
The challenge we had was to create an earbud with enough airspace for the sound to fully develop and breathe. Unfortunately, traditional earbuds are about the size of a jelly bean, and there's just not enough airspace. However, that changed when we developed Airflow Audio. Airflow uses an air tube to deliver 6 to 8 times more airspace than traditional earbuds. The end result is a true live listening experience, just like you're at a festival or a concert. We also added magnets to the back of the earpieces, so you can wear it around your neck when you're not using it.
Being that the drivers are 8 inches from the earpiece, the magnets do not affect the integrity of the sound at all.
The orange line represents the frequency transmitting through the wire to the speaker, which then converts to the blue sound wave that develops more as it travels up the air tube, producing a balanced, full body and live listening experience.
Another really cool feature is that these earbuds are sweat-proof and water-resistant because they're coated with a super hydrophobic nanotechnology. So now you can be on a skateboard or riding a motorcycle and listen to music as if you were watching a live show or actually in a recording studio.
We're coming to you for help in bringing these unparalleled earbuds to market.
Oh, you know what? This is a revelation. I always tell myself money is just there. It depends how you pick it up. So, but this is for me, you know. I have to stay positive. Today, I have the privilege to invite my boss, the person that will show you how to pick up the money and where to pick it up. So he's here to let the people know how to make 6-figure income. How about that? So please welcome Alberto Ochoa, the CEO of SBI, to share the valuable information. Hi, Alberto.
Hi, how are you? Thank you for inviting me on your show. And yeah, so I think that 2 years ago when we experienced the pandemic, a lot of people started realizing that perhaps it was in their best interest and the best interest of their families to look for opportunities where they can have flexibility, self-employment, financial freedom. And so we offer a very, very, very significant and unique business model in which people can actually start in the business of Medicare or selling health insurance products, or offering and educating seniors on the Medicare health plans, and have an opportunity where they can make lifetime residual income offering products that, number one, people need, right? It's almost like auto insurance where you have to have auto insurance. Products that enhance health, enhance your your living situation. All those products that are zero cost. People say, well, how do you offer something that is zero cost and how do you make residual income off of that? Well, it's easy. These plans are sponsored by the federal government, so they give money to the private insurance companies to distribute these products. And us as the external distribution channel, our job is to educate people via seminars, via mailers, via doing educational workshops. So, there's a lot that goes into it, but just imagine this, Maria. Imagine having an opportunity where the clients or the prospects are
Yes.
boundless, right? There are over 65 million
Medicare.
Americans with Medicare across the country. That figure is about to balloon to 85 million within the next couple of years. And then you have an opportunity to sell them a product which they need and can afford at zero cost, right? Now imagine yourself as the person that presents that opportunity being the person that obtains, for presenting that opportunity to them, a lifetime residual income, right? What does that mean? That means that every month that you introduce somebody to the health insurance product, your income keeps growing and growing and growing. And our business model educates people like you,
Yes.
right? Whether you're licensed or not, because we do take people of all realms of professional development, whether they've never had a license or whether they're looking at getting a license, and we help them obtain their license if they don't have it. And people like you that may have a license for health insurance, or maybe you have a license for selling life insurance, and now you want to complement this together with health products or health insurance products, we can show you how to do that and earn a residual income. There's a lot of people out there that dedicate their time to doing final expense sales, or they dedicate themselves to doing, products that are like, for cancer, right, or heart attack, stroke. You can actually, use that and use the leverage and leverage your existing clients to offer them a product that they're going to need anyways, right?
Yes, right.
All you do is you sit down, you show them, and pretty much everybody needs this. Everybody who's over the age of 65 has some form, shape of needing this product. And all you do is you're the conduit between the carriers and the consumer, because at the end of the day, the consumer is not very well educated. And so you are, as a licensed professional within the health insurance sphere, and in particular Medicare. Now, there's a lot of ways that you can go health. You can go under 65, you can offer Obamacare. We do all that, but we specialize in Medicare, which are people over the age of 65.
Exactly. So maybe you cover some part of it, but just to make sure, could you kindly explain how they can avail of this program that you have, like making six-figure income?
Yeah.
Could you please explain the process of
Yeah,
it?
so the process is simple. All somebody needs to do is bring their desire, their want,
Yes, I agree.
their,
Willing to work, willingness to
their ethic, their
Yeah.
flexibility, and we have a system, and we
Yeah.
plug them into that system.
Yes, that's what I want to hear, the
And-
system, yeah.
And if they plug into that system, they're going to be successful, right? I mean, very few times do I have somebody that buys into it, does everything we say, and them not have success. Very few times we run into that. Most agents that have a half a brain, because you don't need to be a genius to help people,
Yeah.
right?
It's a no-brainer.
And if you're somebody who works hard and is flexible and is willing to follow a proven blueprint, you should, theoretically be making close to $12,500 every single month within 5 years, right? It's going to be hard work. Nobody said it's going to be easy.
Yeah.
Some people may get there faster. Some people, it might take them 10 years to get there, but still, I mean, would you sacrifice 10 years of your life
Yeah.
and still make money along the way and to make that? So number one, we have a blueprint. Number two, all you have to do is bring the desire. You have to bring your, your desire, your hard work ethic, your flexibility, your willingness to help people, and everything will take care of itself. The money will come, as you said earlier.
Yeah, it depends on how you pick it up. And
That's
of course,
right.
It all goes together,
Mm-hmm.
So, Alberto, I know that you have good staff, and then and they're very supportive. Please let the viewers know what kind of support they can expect from your team, because I mean, not some other agencies, they only have one helping
Yeah.
everybody, but with your office, it's corporate setting wherein there's one in charge for every need of every
That's right.
agent. So
That's
I
right.
wanted you to expound on that. They're taking care of the onboarding, somebody taking care of the training, yeah, kindly, so that maybe our Medicare members would like to join in your
Maybe
team.
become a member
yes,
too. Yeah.
of course.
So
You're
yeah,
welcome.
you know, from the very beginning, you can expect a concierge service from being introduced to the opportunity, whether it be through a lunch or through one of our seminars or one-on-one with Maria or myself, all the way to what we call RTS, or RTO, ready to offer. And that's when you are capable, you're trained, you're certified, you're contracted, and you're appointed to sit in front of somebody and intelligently explain to them what their Medicare options are. That process can take anywhere between a month to a couple months, depending on the timeline of the person. Again, we customize our service to the agent that we're onboarding. But as you mentioned, Maria, yeah, there are several aspects of our business and our support. You know, we have a trainer, we have an onboarding, we have a contracting person, we have somebody that handles small customer service issues, we have a follow-up person. And within all that, that's just the beginning, because there's other support tools that aren't necessarily human resources. We have, for example, a CRM. We have an enrollment tool, several enrollment tools, for that matter. We have the compliance tools that are needed within this business. You have your own personal number assigned to you. You have content, you have product, you have marketing, training all year long. You get support from us, whether it be helping us support you on purchasing leads or doing seminars. We're there to help you with that. So not only is there a staff behind it, but there's also other automated processes that help us in this journey of becoming a Medicare/health insurance agent.
Oh, I see. How about if other people from other states would like to join your team, Alberto?
Yeah, so we are licensed and appointed in all 50 states. So if anybody wants to join our team, they get the same level of onboarding, concierge, assistance, help, support as anybody else would. So, you know, as a matter of fact, sometimes there are better opportunities in other states, because some states, for example, they're brand new to the product, right? They've never had a Medicare Advantage plan or Part C. They've only been on original Medicare. So we find a lot of pockets across the country where people are really, really in enormous need of a professional to help them explain what their potential, liabilities are or holes are within their health plan. And so what our job is to educate those agents, to give them the capacity to be able to educate seniors on this. So essentially that's what we do on a high level. And just as we have a process here in Nevada, we can duplicate that process across the country.
Got it. So is there any other information that we missed?
No,
Parting words, Alberto?
Yeah, so I just wanted to say, look, we help everybody. If they want to become an agent, like I mentioned earlier, we have a blueprint. You just come to us with the desire, with the hard work, with the ethic, with the willingness to learn. But you don't necessarily have to have a license. This could be, for example, a career change for you, right?
Yes.
Some of our best agents are people that have been educators. And because they've been educators, they're used to educating people. So for them, it's a natural transition into the Medicare space. We have people that were engineers. We have people that were doctors. We have people that are attorneys, right? So it doesn't only have to be an agent that already does this. It could be somebody who's looking for a new career change. Because at the end of the day, we can get most agents to making $120,000, $150,000 a year residual income, to where if they want to take July and August off, they could do that, right?
Yeah.
So we want to help everybody get there. We want to provide the tools, the blueprint for anybody to be able to do this. Obviously, we welcome agents that already have a license or they're in the insurance space, whether they're offering auto insurance, car insurance, or life insurance. There's a place for them here, because there's an old saying in the insurance industry that the more products you're able to bundle in a home, the higher the retention is. So in other words, if you're able to be somebody's life insurance agent, health insurance agent, and auto and home insurance agent, there's a likelihood that you're going to keep those products under you for a long, long time.
Yeah.
So we welcome anybody who's interested. Maria is actually one of our most successful, most developed managers.
Thank you.
And you can reach out to her, or you can go to our website, sbibenefits.com. You go to becoming an agent. There's a little tab on the right-hand corner. You click on it, and your information goes directly to us. So we can give you a call back and explain to you guys how this business works and how we can make you as successful as possible.
Yeah, folks, you know, a lot of seniors are on the, like, they need more income to support their daily living, or to have both ends meet. So, I mean, since you're on Medicare, might as well.
That's right.
This is a good
Most seniors
career,
know.
yeah.
Most seniors know at least 4 seniors, and then if those
Yeah.
4 seniors know 4 other seniors, then it becomes a web. And you know, to your point, even if you have 100 clients that you're helping, that's still $2,500 a month.
a month. Yes.
I mean, if you're getting from your Social Security $2,000, you just doubled your income, and that's pretty
Yeah.
much by helping people enroll in something that doesn't cost anything, that is going to improve your life, that's going to improve your health, and you know, pretty much, you know, all it takes. You don't have to go out and get a loan. You don't have to go out and buy a franchise. All you have to do is get a license, get contracted to offer the product, and then
Yes.
meet with somebody like you or myself that can take them throughout the journey.
Yeah, and then especially watching my program, they can learn about Medicare. So the
There you
training
go.
is, they get entertained and they get the training.
That's right.
Yeah, plus, you know, based on my own experience, I'm a migrant here, and I don't have much contribution with the Social Security. That's why I try to find a job that has a residual. So now, I've been, every month something comes in,
Yeah.
there's auto deposit to my account, so I don't stress out, oh, where am I going to get my rent? Oh,
Yeah.
I'm not qualified for Social Security pension.
It definitely
At
gives you
least,
some flexibility in
Yes,
lifestyle.
yes, I do. And then I'm a living proof that this job is something that would help you in life, and it's a good living. I mean, you help people, you with their needs,
Yeah.
and then the thing is, they don't even lift a finger. Just talk.
Yeah.
You don't have to do any cleaning,
Right.
physical effort to do things. Just
Yeah.
be friendly, talk to them, and then
It's a gift,
be responsive to their needs.
Yeah, and then
Yes.
it's a gift that keeps on giving, because once you get a consumer in, you start making that per month residual, which adds up quickly. You know,
It does.
many people, it takes them at least 1 or 2 years to get to that 100 member or 100 customer threshold, where they can, you know, really start living pretty freely without having to go work at a 9-to-5 job. Yeah, you're still going to do work with follow-up. You want to talk to your clients all the time. You want to make sure that they're doing well. But I mean, at that point, you're not really working that hard. You're just kind of, you know, maintaining and helping your clients and that sort of thing. And some of them, you never hear of them, you know, because they know how to manage everything on their own, and they're very low maintenance. Some people, yeah, you hear from them all the time, but still, it's good that you hear from people, because that means they're still your client, number one, and number two, they're so happy with your service that they're probably going to refer you to somebody else.
Yes. Yeah, guaranteed. To me, I tell them, just like I have a recruit now studying to have license, I tell her, just like you said, 1-2 years, but to me, just to make sure, I said 3 years.
Yeah.
You can pay.
Yeah.
You can pay, because with other Medicare, some of my Medicare clients, they can even pay the rent with what they're getting. But if you're a Medicare agent, I assure you, you can get an apartment of your own. You don't have to like live with your kids or live with somebody else and just rent a room. At least you have your own privacy.
Or live
And-
with people you don't like.
Yeah,
Right.
yeah, exactly. Okay, so Alberto, we wrap up from here.
Thank you. Yeah, thank you very much. Yeah, hope to hear from some of you guys soon. Thank you.
Okay, thank you. Your health and safety are of our highest priority, or for Medicare's highest priority. And in the face of the coronavirus disease 2019, or COVID-19, public health emergency, many people with Medicare are at higher risk of serious COVID-19 illness. So it's important to take the necessary steps to keep yourself and others safe. Medicare covers several tests, important and services related to COVID-19. Coverage could change, and when public health safety ends, of course, it's very important. Vaccines, FDA-approved vaccines help reduce the risk of illness from COVID-19 by working with the body's natural defenses to safely develop immunity protection against this virus. So you pay nothing for COVID-19 vaccine if your doctor or other healthcare provider accepts assignment for giving the shot. Or be sure to bring your red, white, and blue Medicare card with you when you get the vaccine, so your healthcare provider or pharmacy can bill Medicare. If you are in Medicare Advantage plan, you must use the card from your plan to get the Medicare covered services. Well, just like diagnostic test, this FDA approved test to see if you have COVID-19. You pay nothing when a healthcare provider orders this test during the COVID-19 public health emergency, and you get it from a laboratory, pharmacy, doctor, or hospital. So next is antibodies. So it's just like after you got, they said when you get COVID, you develop antibody. So this FDA authorized test helps see if you've developed an immune response and may not be an immediate risk of COVID-19 reinfection. So it's very important to have that antibody. So you pay nothing for the test during the COVID-19 public health emergency. So what is over-the-counter test? Just like it's a test pack you have it at home. So it's something like, just like when I just recently had the COVID-19. Good thing I have this test pack wherein I just unboxed it, and then there's a liquid, and then there's a swab. So you open that liquid, you swab your inner nose, inside your nose, and then put it in the dip, and then there's like a test, something you drop that, you put a drop of your, the combination of that liquid from your, and then the mucus from your nose, and you will find whether you're positive or negative. So if you have Part B, Medicare will cover up to 8 over-the-counter COVID-19 tests at any participating pharmacy or healthcare provider for each calendar month until COVID-19 public health emergency ends. So, I mean, if you walk by a pharmacy, the big box pharmacies, show them your Medicare, get some test pack, because that's for you. If you feel, it's still on, although at this time, the weather is hot, but still you have to have it. So if you feel like coughing, sore throat, have yourself tested just to make sure. So if you're in a Medicare Advantage plan, you won't get this benefit through your plan, but the test will be covered directly from your Part B. Check with your plan to see if it covers additional over-the-counter COVID tests. You pay nothing for this test during the public health emergency. So if you have other coverage, you may also get free tests through other coverage. Next is after your initial enrollment period is over, you may have a chance to sign up for Medicare during the special enrollment period. For example, if you didn't sign up for Part B, or if you may have to buy a Part A, when you were first eligible, because you have a group health insurance coverage based on your employment, your own or your spouse's or your family members if you have a disability. You can sign up for Part A or Part B. Anytime you're still covered by the group health plan, during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first, Usually, you won't have to pay a late enrollment penalty if you sign up during special enrollment period. This period doesn't apply if you're eligible for Medicare based on end-stage renal disease or ESRD, or you're still in an initial enrollment period. Well, take note, if you have a disability and then the group health plan coverage is based on family member's current employment other than a spouse, the employer offering the group health plan must have 100 or more employees before you get into the special enrollment plan. Actually, this is like some parents who are already on Medicare and they have a child who is on disability, who becomes disabled. They also are entitled to a Medicare coverage. So let's go to the next slide, new start date for Medicare coverage. If you pay for Part A but didn't sign up for it, or don't sign up for Part B, for which you must pay premium, during your initial period, remember initial enrollment period is before turning 65, and then you were not able to sign up, then you don't qualify for special enrollment period rather. You can sign up during the general enrollment period or GEP from January 1st to March 31st each year. You may have to pay a higher Part A or Part B premium for late enrollment. So if you are not eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up to 10%. So you have to pay higher premium or twice the number of years you could have had Part A, but didn't sign up for it. So for example, if you were eligible for Part A for 2 years but didn't sign up, then you have to pay 10% premium for 5 years. 4 years rather. So kidney transplant and immunosuppressive drug coverage. If you only have Medicare because of your end-stage renal disease or ESRD, your Medicare coverage, including immunosuppressive drug coverage, ends 36 months after a successful kidney transplant. Medicare offers a benefit that helps pay for your immunosuppressive drugs if you don't have certain types of other health coverage like group health plan, TRICARE, or Medicaid that covers immunosuppressive drugs. This new benefit only covers your immunosuppressive drugs and no other items or services. It isn't a substitute for full health coverage. You can sign up for this benefit anytime as long as you had Medicare because of ERSD at the time of your kidney transplant. To sign up, you may call Social Security Administration at 1-800-772-1213. TTY users can call 1-800-325-0788. As a reminder, please take note, you'll pay a monthly premium of $97.10 and a deductible of $226 for this benefit in 2023. Once you've met the deductible, you pay 20% of Medicare approved amount for immunosuppressive drugs. If you have limited income and resources, you may be able to get help from your state to pay for this benefit. Learn how accountable care organizations are driving better care. An ACO won't limit your choice of healthcare providers. If your doctor or other provider is part of an ACO, you still have the right to visit any doctor, hospital, and other provider that accepts Medicare at any time. In addition, if your primary care provider participates in an ACO, you may be available to get expanded benefits. For example, in some ACO, some provider may offer some telehealth services. This means you may be able to get some services from home using technology like your phone or a computer to communicate in real time with your healthcare provider. So next is get help paying Medicare health and drug costs. You automatically qualify for extra help if you have Medicare and meet any of these conditions. You have full Medicaid coverage, you get help from your state Medicaid program paying for your Part B premium, or you get supplemental benefits like the Supplemental Security Income, they call it SSI benefits. Medicare will mail you a purple letter to let you know you automatically qualify for extra help. Keep this for your records. You don't need to apply for extra help if you get this letter. Or then, if you don't already have Medicare drug coverage or Part D, you must get it and use this extra help. If you don't have drug coverage, Medicare may enroll you in a separate Medicare drug plan so that you'll be able to use extra help. If Medicare enrolls you in a plan, you'll get a yellow or green letter letting you know when your coverage begins. So, first, you get a purple letter saying you qualify. And then, second, you'll get another mail saying that, now this time it's a yellow or green letter letting you know when the coverage begins. So those are two things. For purple, you qualify, and then yellow or green when the coverage begins, okay? And you'll have special enrollment period to change plans if you want to join the different plan other than the one Medicare enrolled you in. So there are different plans to cover different drugs. Check if the plan you're enrolled in covers the drugs you use and if you can go to the pharmacies you want. So for that information, you can visit medicare.gov/plan-compare or call 1-800-MEDICARE, and that is 1-800-633-4227 to compare your plan with other plans in your area. TTY users can call 1-877-486-2048. If you have Medicaid and live in a certain institution like nursing home or get home and community-based services, you pay nothing for your covered drugs. So this is very important, get help in a crisis. So I had this guest from NAMI, wherein the National Association for Mental Institute, something like that. Anyways, that was the first time I heard about this 988 line, wherein it's very important that when somebody is in a crisis, you felt that he's going to go do suicide or other weird things that's not normal. Of course, the 988 Lifeline provides 24/7 confidential support to people in suicidal crisis or mental health-related distress. By calling or texting the 988, you'll connect to a mental health professional with Lifeline network. In many cases, the first voice you hear on the helpline may be an automated one. If the service is having a busy night, the automated message will tell you to stay on the line until a worker is available. In other cases, the message may offer you additional options such as the option to switch language and other prompts. Just follow the prompts so you'll be able to be assisted. Okay, following next, I got how to apply for Medicare Part A and Part B. So when you apply or retirement with the disability benefits from Social Security, it also serves as an application for Medicare. Say you you retired on 62, so automatically you are enrolled with a Medicare plan. So once you get approved for Social Security or Railroad Retirement Board benefits, you will automatically get Part A coverage without having to pay premium for it because you contributed a minimum of 10 years or 40 quarters. So that means once you have that, you are eligible for you have contributed, you're eligible for Medicare. If you're getting benefits from Social Security or Railroad Retirement Board, for at least 4 months before you turn 65, you will automatically get Part A coverage. You will also get signed up for Part B unless you live in Puerto Rico or other outside the United States. Because you pay a monthly premium for Part B coverage, you can choose whether to keep it or not. So let's go to apply for Part A. Of course, you could always walk into any Social Security office administration. And then you can apply online by creating an account with www.ssa.gov. This means Social Security Administration.gov. And make sure it has a .gov because that's the site, that's a government site. The gov means a government. So apply online, Social Security. This is the easiest and fastest way to sign up and get any financial help you may need. You'll need to create your Social Security account to sign up for Medicare or apply for Social Security benefits online. Likewise, if you open an account, you will see how much you contributed, and you would also see how much you're going to get. And then you could click on Medicare there so that you could already apply for your Medicare card. Well, you could always call 1-800-772-1213. TTY users can call 1-800-325-0778. Likewise, you can, of course, just like I mentioned, you can always walk into the nearest local Social Security administration. And one more thing that you have to, anyway, later I'm going to explain what forms or what documents you're going to bring to the Social Security in order for you to be able to get your Social Security card. So next we have how to apply for Medicare Part B. It's the same thing. You can apply. You can create an account, fill out the form, or this is one way. Fill out the form CMS 40B to sign up for Part B if you already have Part A. Take note there, because the reason I told this, because there are most of the time if you have health insurance from work, I mean, you're still covered, you will not get your Part B. That's why this is like the special enrollment period wherein you can get your Part B anytime, and you can also log into the Social Security or go to the nearest Social Security office. So send the completed form to your local Social Security office by fax or by mail. However, I'm going to explain what are the attachments that goes with this form, okay? The first month after your initial enrollment period ends, it ends 8 months after the group health coverage or employment ends, which happens first, of course. So, next slide, so I can explain it further. You could, likewise, you can apply using the CMS 40B form. So, if you're in your initial enrollment period and live in Puerto Rico, you must sign up for Part B using this form. If your IEP or initial enrollment period and refused Part B or did not sign up when you applied for Medicare, but you want Part B. So for example, you were not able to sign up when you turned 65 and now you want your Part B, you can use this form. Okay, if you want to sign up for Part B during the GEP, which is General Enrollment Period from January 1 to March 31st, each year you have to use this form. So if you refuse Part B during your IEP or initial enrollment period because you had group health plan or GPH coverage through your spouse's current employment, you may sign up during the 8-month special enrollment period. So if you lost your coverage from employment, 8 months after you can enroll. But of course, it's better to sign up before you lose it so you don't lose any health insurance coverage. So if you have Medicare due to disability and refuse Part B during the IEP because you had group health plan coverage through you, your spouse, or your family member's current employment, You may sign up during the 8-month SEP, Special Enrollment Period. So now, next slide is the CMS L564. So this is the employer's information. This form is used for proof of group health care coverage based on current employment. This information is needed to process your Medicare enrollment application. So it goes hand in hand, okay? You have to submit the CMS 40B and the CMS L564. So the employer that provides the group health plan coverage completes the information about your health care coverage and dates of employment. Form CMS L564 is an employment information form from Social Security Administration. It is used in conjunction, just like I mentioned, with the form CMS 40B when you apply for Medicare Part B during a special enrollment period. That means after you turn 65 and you were not able to enroll in Medicare, you have to use these forms. But make sure you have both forms sent to Medicare if you want to apply for Medicare in the mail. So one portion is completed by you, which is the CMS 40B, and the other is completed by employer or your spouse's employer, which is the CMS L564. So these are the attachments: birth certificate, proof of U.S. citizenship or proof of legal residency for 5 years, your Social Security card, health insurance information, which can be found to the CMS L564, military documents if applicable. So once you submit the documents, these are the requirements that you have to send. The CMS 40B, which is the information about yourself, CMS L564 application, which is the information from your employer, copies of state ID, copy of Medicare card if necessary, because for example you already have your Part A, that's why I put their copy of Medicare card, green card or U.S. passport, group health insurance, Medicare ID. Oh, I already mentioned the Medicare Part A ID. Yeah, you have to have like a copy of those attached to your application, and make sure I put their mail with confirmation receipt, because to make sure that a green card form will be sent back to you to make sure that they receive your application. Otherwise, you're waiting for nothing if you just mail in just because you want to mail it and you want to save money. But it will be useless because you don't know whether they receive your application or not. Oh, it's another hour had passed. I would like to thank my boss, Alberto Ochoa, for sharing how to get a realistic 6-figure income. It is something very interesting since it's fun to help people with their Medicare and health insurance concerns. I was able to cover new and important Medicare information for 2023. Rest assured, I'm here to continue to enrich your Medicare knowledge. I would like to send love, hugs, and kisses to all my clients, and to those who needs a reliable agent and you're looking for one, well, I'm looking forward to be a part of your Medicare journey. I'll see you in another episode of MariaCares Senior Info Guide. Take care of your health. That's the only one you got. Let's join hands to a better health.